We are in a war, and physicians, healthcare workers are on the front line. So we see not the enemy, but the effect of this enemy. So I understand that it's difficult for people who are not seeing the effect to understand how serious things are. This is not a joke. This is not a joke at all.
So how would you characterize the pandemic at this very moment in Italy?
You know that in Italy we have a death rate possibility higher than China.
Everything is an emergency. We are carrying very severe patients with a shortage of beds, with a shortage of medical equipment, ventilators, and also healthcare workers are in a limited number. This will be the same for every healthcare system. There will be no difference.
You mentioned how you and your colleagues have had to make difficult choices. Can you talk about some of the decisions you've had to make and how you balance that with who has the best chance to survive?
This is an important question. It's a tough question. First of all, we are physicians, so we are devoted to save as many lives as we can. But now, for us, is more and more difficult to be and to consider ourselves physician in the strict meaning of the terms. We are confronted to choices which are done in a very difficult condition with much pressure. Personally, something which is for me extremely difficult is the moments of dying. Families are contacted by phone to tell them that their beloved is dead. So communicating only by phone is something like this is extremely difficult. And another thing that is very hard to cope with is also the emotional pressure that each of us has to manage, also to sustain all the other people, all the other colleagues. I have colleagues that even when they are very tired and emotionally stressed, they are crying.
You know, this is the first time that we fight against a pandemic
like this.
Like this is for us is the first time, but I think for the world.
How are you both faring emotionally, and how do you find moments of hope, I guess, in the midst of all of this?
You know, we as a physician, especially in the critical care world, we always have probably an intrinsic hope for everybody. Mm-hmm. Otherwise, I think it would be very difficult to being a physician.
You need to be strong for everything, for everybody.
But this is our hope, and also we are doing for our families. My wife is pregnant, and I have a little child of 18 months. We decide to live separated since 15 days. So I come back at home. Sorry. When I am not in the house, my wife goes in the house and leave me something for the food, for the dinner, and we see by the phone. And this is since 15 days. This is my life.
Yeah, my life is completely different from my colleagues because they don't have family. But you don't think that is easier because
It's difficult for everybody.
It's for everybody because when you work all day, some colleagues work 24 hours, 18 hours. You don't have a time, okay? But when you back in the house and you don't have social life is finishing, and the day after you start again.
But we should do this. We are not doing this for nothing. This is extremely important. And I think that if we can do this, everybody can do this.
Yeah.
At the individual level, independently from what the government is prescribing, the most important thing is to understand that avoidance of contacts among people is the single thing which is fundamental.
Tonight, as all the other days, nobody.
And we should not wait for government to say this, to be cautious.